Welcome to The Explainer. Today, we're going to dig into a massive gap in our healthcare system, and it reveals something pretty startling about what and who we really value.
All right, let's really get into this. This idea, it's pretty much the heart of everything we're talking about today. Think about it. What we decide to screen for, what we pour research money into, that's not just about science. It's a statement. It's about our values. So you have to ask, what happens when a huge health crisis, one that impacts millions of people, just gets ignored?
So, we're going to explore a public health issue that's just staggering in its size, and it directly connects intimate partner violence to traumatic brain injury. This is a crisis that's been hiding in plain sight for way, way too long. I mean, just think about this for a second. When a football player takes a big hit, what happens? Instantly, there's a concussion protocol. It's automatic. We expect it. So, here's the really tough question. Why on earth don't we have that same level of care, that same urgency for survivors of intimate partner violence? Okay, to really get why this is so incredibly urgent, we have to look at the scale, the sheer numbers. So let's build this out piece by piece. We're going to use global data to show you just how big this hidden epidemic really is. So where do we start? Well, we start with the World Health Organization, and their data shows that almost 1 out of every 3 women on the planet will experience intimate partner violence at some point in her life. 1 in 3. And here's the next piece of the puzzle, and this is critical. Research shows again and again that of those women, a staggering 3/4, 75%, will end up with a traumatic brain injury because of it. Okay, so what happens when you put those two numbers together? You've got that 30% of all women and then 75% of them who get injured. Well, the result is, frankly, it's shocking. And here it is. The math shows that 22.5% of all women on the planet, that's about 1 in every 4.4 women, will sustain a brain injury from intimate partner violence. Just let that sink in for a second. 1 in 4.4. This is not some small niche problem. This is a massive mainstream public health crisis. Now, to really put this into perspective, let's compare it to another major health issue, one that pretty much everyone knows about. Because when you see them side by side, the difference in how we respond is it's impossible to ignore. And get this, the comparison is stunning. Based on your lifetime risk, this kind of brain injury is way more common than breast cancer. And breast cancer, as it absolutely should, gets a huge amount of public attention and funding. Just look at these numbers. You've got IPV-related brain injury sitting at 22.5%, and then breast cancer at 12.9%. I mean, it just towers over it. The scale of this problem is absolutely immense. But does our response as a society even come close to matching that scale? You know, for breast cancer, we have massive awareness campaigns, right? Pink ribbons everywhere. We've got routine screening built into our healthcare, billions of dollars in research. But for IPV-related brain injury, which remember is more common, the response, it's minimal, it's fragmented, it's completely underfunded. The contrast couldn't be more stark. So that's the big question, right? If this is so incredibly common, why do we keep missing it? And what happens when we do? What are those devastating ripple effects when it just goes completely untreated? All right, let's break down the main reasons this diagnosis stays hidden. It's like a perfect storm that leaves survivors completely without the care they so desperately need. First off, a lot of survivors just don't seek medical help for the injury itself. Then you've got the symptoms, things like confusion, memory issues, being irritable. Well, those often get mistaken for the emotional trauma of the abuse, not as a sign of an actual physical injury to the brain. And the final piece? The healthcare system itself just isn't looking for it. There are no routine screenings and not enough training for doctors and nurses. And when a brain injury like this gets missed, the consequences, they don't just stop with the physical stuff. No, they cascade. They trigger this whole chain reaction of challenges that can completely destabilize a survivor's entire life. I mean, an undiagnosed brain injury can make it almost impossible to hold down a job. Think about trying to navigate a complicated legal system, or even just engage with the support services that are supposed to be there to help you. Survivors are left trying to handle not just their own health, but a whole web of systemic failures. And it all comes back to that one misdiagnosis. So, okay, seeing the problem is the first step, for sure. But the good news is the evidence doesn't just show us the problem. It actually points us toward a really clear, actionable path forward. The data shows us the solutions too.
So here are 4 huge changes we need to make. Number 1, we have to systematically screen for brain injury anytime intimate partner violence is on the table. 2, we need to build integrated care pathways, basically a bridge connecting violence support services with brain injury experts. 3, we've got to fund the research at a level that actually matches the scale of this 1 in 4.4 crisis. And finally, number 4, we have to train our healthcare professionals so they know what to look for.
When it comes down to it, we have to completely shift our perspective here. A brain injury from intimate partner violence isn't some side issue for social workers to handle. No, this is a major public health crisis, and it demands a serious, integrated, and well-funded response. So the data's in. We know the scale of the problem. This injury isn't hidden anymore. Now that we can see this crisis for what it is, the responsibility isn't just about knowing anymore. It's about doing. So the only real question left is, what are we going to do about it?